us. I want to welcome those of you who have joined us this morning. This town hall reaches San Luis Obispo County residents and Monterey County residents living in the 17th Senate District. In just a couple of moments, I will introduce our guests, Dr. Grover and Dr. Bornstein. I just wanted to begin with a couple of welcoming comments, and we do bring this gathering in the middle of the COVID-19 pandemic, one that is really unprecedented in current times. And the state of California has been moving aggressively to try to respond to both the medical needs and the economic social needs in our communities. I do want to just mention that our unemployment insurance office through EDD has issued more than $3.5 billion in checks or direct deposits since March 15th. We've received more applications since March 15th than during all of 2019. And then I think also important to share with friends who may not be direct employees, but maybe independent contractors or self-employed, that the Pandemic Unemployment Assistance, PUA, will be available starting for application next Tuesday, April the 28th, through the EDD office in California. So you'll be able to go online to apply for benefits supported with federal contributions and state administration for those PUA funds if you are self-employed or an independent contractor. But please wait until next Tuesday, April the 28th, to go to the EDD website. I also just want to acknowledge with sympathy, the loss that many in our country have faced, the loss of family members and loved ones. Our thoughts are with all of you. As we know, this goes beyond the borders of our country. It is truly an international pandemic, and California has moved quickly, but also suffered losses. We've lost over 1,268 Californians. Many more have tested positive. In decisive action moving forward, our goal is to limit that spread, to contain the virus, and to restore our economic engines as quickly as possible. That said, and the doctors will be contributing to this, it will be important that in our communities, we follow the advice of our public health officers, of the medical community, and make sure that we move in appropriate manners as people are anxious to return to some form of normalcy, both in work and our day-to-day lives. That said, before I turn over to the doctors, I want to acknowledge the really heroic work of many of our essential workers, from farm workers to health workers, doctors, nurses, other hospital and public health workers, grocery workers, all the delivery workers delivering food and other services to people's homes and apartments throughout the country, throughout our region, throughout our district, many at great risk, many at sacrifice for their own families to serve the broader community. So we're seeing some tremendous acts of heroism and courage, and I just want to acknowledge those constituents and offer my thanks. I know I speak on behalf of many in extending our thanks to you. And with that, I will now be introducing our two guests. They will each speak for about 5 minutes, and your questions as you send in to our Q&A platform at the bottom of your screens will be reviewed and directed to any one of the three of us in about 10 minutes. Our guests today are Dr. Casey Grover, who's an emergency room doctor at the Community Hospital of the Monterey Peninsula, and also the public health officer in San Luis Obispo County, Dr. Penny Bornstein. They've both been particularly busy since the outbreak of the virus. I want to thank both of them for their service to our communities. And without further ado, I will ask Dr. Grover to please share some of his observations and ideas for best practices as we move forward. Thank you both. And again, thank you all to joining us today.
Good morning, everyone. I want to start off by saying thank you for including me on this webinar. I'm honored to be here and to be in the service along with my colleagues in the care of people in our community. I also want to echo the thank yous of all of the healthcare workers who have been coming to work every day to take care of our communities. I speak today as an emergency physician at Community Hospital of the Monterey Peninsula. I am also the medical director of the emergency department at Community Hospital of the Monterey Peninsula, and so I've been involved with preparation efforts for the coronavirus in our community since late February, maybe even before. I wanted to bring up a couple of things that folks have probably seen in the news that they've heard that there are concerns about. And I want to first start by saying that there has been an enormous amount of work in Monterey County between the 4 hospitals, as well as the county agencies and the public health office to prepare as best we can. And I sincerely believe that we have done our best to prepare given the information that we have. And I can speak mostly about Community Hospital, and we've created plans for a flat curve, an ideal response, as well as a very sharp curve, a catastrophe response. And we have various levels of ways that we plan to accommodate patients in those various scenarios. Interestingly, in our community on the peninsula, the hospital itself and the emergency department are at about 50% of capacity, meaning that folks are listening and they are staying home. And we have the ability with available beds in the emergency department and the hospital to take care of patients when a surge arrives. I can say also that doctors, nurses, and hospital staff have been extremely creative in trying to come up with ways to keep people getting medical care. As an example, in our emergency department, thanks to help from our IT department, we're able to do a follow-up visit via telehealth. If you come in with a wound that we're worried might be infected, we have the ability to see you via telehealth to make sure that wound's looking okay in 2 days. Additionally, our large physician group, Montage Medical Group, is doing a lot of telemedicine encounters to keep both medical providers and patients safe, and many of our community physicians are doing the same. One thing that we've seen that's a very interesting problem that I don't think anyone anticipated is by folks staying home, we're actually seeing some very serious illnesses in people who should have presented to the hospital sooner. And it's a tough balance. I'll give you some examples from my physicians in the emergency department. We had a gentleman who actually died from a heart attack. He had chest pain at home, didn't want to go to the hospital out of concern for coronavirus, and unfortunately suffered a cardiac arrest. We had a person who had bleeding after surgery and required a blood transfusion and emergency surgery that might have been prevented. So I think it's a double-edged sword in that we want folks with minor illnesses to stay home, but at the same time, if you believe that you're having a serious medical problem, the hospital is absolutely committed to providing you safe and effective medical care. And we are spending so much time working to ensure a clean and safe environment in our hospital, as well as in all of our clinics. Personal protective equipment has been an issue on many people's minds. Thank you to my hospital, who has worked tirelessly to get protective equipment for hospital staff. And our hospital is also collecting donations for those who want to support hospital staff. Another thing on people's minds are ventilators. If somebody cannot breathe because they are affected by this virus, they may require a ventilator, which is a machine to support their breathing. And people have probably heard that in New York, they've been running out of them, and it's become a very difficult situation. At this time in Monterey County, we've had very few cases that have required intensive care unit or ventilator care. In fact, I believe at Community Hospital, we've only had 3. However, at the same time, we want to prepare for any surges. And so we've actually secured a number of additional ventilators and have capacity to use other devices to function as ventilators if we ever get to that scenario. I think I'm pretty close to the end of my 5 minutes, but I think the bottom line is that in Monterey County, the county health department and our hospitals are working tirelessly to prepare. And I just want to reiterate that if you believe you are seriously ill and need medical care, hospitals are committed to providing it in a safe and effective fashion.
Thank you so much, Dr. Carlson and Dr. Grover. You came in right on schedule. We appreciate that. And I think just to repeat the important takeaway, anyone who's experiencing health problems or challenges should be in contact with their primary care physician, and if necessary, not to hesitate from seeking hospital care if advised by their primary care physician. Now I'd like to turn to Dr. Borenstein, Public Health Officer of San Luis Obispo County. Thank you, Dr. Borenstein.
And thank you, Senator Monning. It's a pleasure to be here with folks today, but the reason has been unprecedented in the history of public health. And I know that folks are really struggling. So I appreciate all that our community as well as our essential workers have contributed to helping us manage this situation on the ground. We're especially grateful in San Luis Obispo County for the relative sparing of this disease. There have been 134 cases, but 17 of those have landed in the hospital, 6 with intensive care needs, and only 1 death. And we are extremely grateful, perhaps lucky, that we have been spared some of the travails of other communities, in that we've had no cases in our long-term care facilities, in our corrections facilities, in our forensic hospital. So with that, people might say, well, then why have we taken all these draconian measures? And it's a bit of a chicken and egg. So if we hadn't acted early, we have no way to determine what things might have looked like. We definitely have seen in other places, other countries, other parts of the US, that even with action, if it wasn't aggressive and early, things could get out of hand, and we don't want to see that in our community. Yet here we are in a good place, and we know that we need to begin relaxing our restrictions. The inseparability of economic welfare of our community and individual health is well understood. We don't want to have more harmful effects from the actions that we're taking and even fatalities because of the restrictions and preventive measures that we've put in place. We know that there is a strong nexus in healthcare outcomes related to poverty, related to economic downturns and suicide, domestic violence, heart attacks, strokes. You heard Dr. Grover talk about some of those examples of people delaying care. And so we need to find a really well-balanced approach, as we did going into this, and we will coming out of this. So as we reopen, and we feel that we're ready to in San Luis Obispo County, as we have had nearly 3 weeks now of a flat curve. We have had no more than 4. Today we'll actually report 6, but largely on average 2 to 3 cases, new cases a day in our county for almost 3 weeks now. So as we begin to reopen, we are sure that we need to do this, but we absolutely are committed to doing it in a careful, sensible, and health protective way. This is not a light switch, as I and others have said. This is more of a dimmer. So some of the things that we're doing locally, we are bringing back healthcare as one of the first things that people need, again, citing Dr. Grover's examples. So non-urgent surgeries, we're trying to move that forward with our hospitals. I've asked our healthcare community to begin to return to some measure of normalcy, taking care of chronic disease management, well child care, immunizations, preventive services, mammograms, et cetera, as we move back into these areas of care. We're asking that religious services can return, but in parking lots rather than in facilities. We have brought up our construction industry and moving forward with permits in that arena. Fabric stores, we are planning to reopen so that people can contribute by making face masks. These are just some of the examples of things that we're looking to do, all the while asking all of the sectors to think creatively of ways that they can come back to business, but do so in a safe way, maintaining physical distancing. We do expect that we will see more cases as we begin to ease these restrictions. And we want to work with our community to not be overly reactive or underreactive. So as we see more cases, if we go from 4 to 6 to 8 to 10, we're not going to go back into a complete hunker down mode. but we are going to watch, as we do in public health. We are known for our surveillance, and we will continue to keep an eye every single day, as we have been, on what the trend line looks like. And we may have to make adjustments. We may have to step back, but we will do so not in a reactive way based on a single day over day situation, but as the situation over the longer term demands. While we can't eliminate disease, we want to modulate the other things that have been caused by our response to this. So we continue to do feeding of individuals who have lost their access to paying for food. We are taking care of our homeless shelters in unique ways by housing sick people, providing childcare for critical workforce individuals. And during this time, we have stood up the capacity to take care of a much increased number of sick individuals. So again, like Dr. Grover said, we've added a number of ventilators. We have an alternate care site. We've gotten our PPE, personal protective equipment, supply chain in order, and we've stood up way more testing. These are the things that will allow us to move forward in a cautious way, and we are grateful to the community for how they've worked with us over the past month and how they will continue to abide by the protective measures that we need to keep in place, and the open and transparent communication that we need to all have as we move forward together.
Thank you so much, Dr. Bornstein. And I think we'll turn now to the staff who have coordinated some questions for our guests.
Good morning, panelists. We have a first question for Dr. Grover. And the question is, if I'm experiencing COVID-19 symptoms, what should I do?
That's a fantastic question. What's difficult about this is that there's no unique symptom to COVID-19. It's, as best we know, an illness that causes respiratory symptoms and fever, but there are some other manifestations. It's challenging because we have and have always had many respiratory illnesses that come and go throughout the year, such as influenza and RSV. And the first thing I'll say is, regrettably, there is a lot of bad information out there, particularly on the internet and social media. So I would recommend starting with a good source of information, such as a county public health website, or I can say for my hospital, at chomp.org/coronavirus, there are loads of resources vetted by doctors, nurses, and infectious disease staff to give you good information. Secondly, the question becomes is, okay, you think you might have symptoms consistent with coronavirus, how bad are they? Let's imagine that somebody has coronavirus symptoms, they're mild, maybe just body aches, a fever, a runny nose. That person should stay at home and, to the best of their abilities, avoid contact with others, whether it's quarantine in a bedroom, using a mask, hand hygiene, avoid sharing food or drink, etc. So really, kind of the first step is, do I think I'm really that ill? And I use ill like a doctor, meaning needing intensive care, needing other medical resources, not just I don't feel good. And then beyond that, if somebody has moderate to severe symptoms, they may need to require medical attention, such as a telehealth visit for starters, or urgent care or emergency department. And those symptoms might include shortness of breath, chest pain or tightness, and definitely something like confusion. And really the idea is that we're trying to keep the hospitals for our sickest patients. And we know that 80% of people with this illness will have a mild illness. And if they can stay at home, that's probably the best. I will also ask Dr. Bornstein for her input if she has any other ideas.
Yeah, I don't at this moment have anything to add to that. I thought that was a super effective answer to the question.
Thank you, Dr. Grover. Our next question is for Dr. Bornstein. Should I wear a mask while exercising outside? And if so, what type of mask should I be wearing?
So the short answer is no. We do not want people wearing face coverings while exercising. The increase in respirations that come with exercise would be at odds with the additional oxygen you need to take in that you can't do while you're wearing a face mask. So the recommendation is to exercise either by yourself or across from a tennis net or further down the field on a golf course or hiking 6 to 10 feet apart. So exercise is important, but wearing something over your face as you're increasing your lung function through exercise would not be a smart way to go.
Thank you, Dr. Borenstein. This next question is for Senator Monning. We're getting questions about PPE and what is the state of California doing to get access to PPE for healthcare workers and healthcare providers?
I know it's been a major priority for our coordinating team in Sacramento with Governor Newsom, the Health and Human Services Director, or Director of California Public Health. They have worked to acquire and distribute personal protective equipment and ventilators. There's been an amazing collaboration between public entities and the private sector to produce these. We know of a lot of volunteer efforts to produce masks. The medical grade ones have been acquired by California. We're continuing to acquire those. We had a briefing yesterday from the California Hospital Association indicating various levels of reserve in hospitals around the state, and actually coordination for some with greater reserves to share with hospitals with lower reserves. So it's a top priority of the administration and one of the keys to the public health response, making certain that health workers have access to protective equipment as well as the public. And I just want to give a shout out to those who have volunteered, both private sector businesses and then nonprofit groups and just creative individuals who have been helping to produce more masks for public use. And the government is responding to the need in medical facilities.
Thank you, Senator Monning. Another question for Dr. Grover. We're getting a lot of questions about the availability of testing. Can you please speak to the availability of testing, including antibody testing?
Absolutely. So I'll start with the antibody testing because that's an easy one. And Dr. Borenstein, feel free to chip in if I missed something. We don't really know yet what antibodies to coronavirus mean. And let me give you an example. People who have HIV develop antibodies to HIV. Those antibodies obviously are not curative of the illness, but do represent a previous exposure. So if somebody has antibodies to the coronavirus, specifically the SARS-2 virus, we don't know if that confers long-term immunity. And similarly with influenza, we know that influenza mutates seasonally, meaning that antibodies to one influenza virus don't confer immunity to the next. So it's really too early for us to know what the antibody testing means. And so people obviously want to know, and my doctors have said, gosh, if I'm antibody positive, I'll work every shift. Put me in, coach. And on the flip side is just because you're immune doesn't mean the next person's immune. So if I go in immune and I don't have good safety precautions, I could actually spread it to patients. So it's unfortunately a little too early for us to really effectively use any antibody testing. Now, in regards to other testing, what they're basically doing is detecting viral particles. And at my hospital, we're using a nasal or an oral swab. And what's been a challenge here is we don't have as many tests as we want. And I know personally, patients have been frustrated with me when I'm working in the emergency department that I want a test, doc, why would you give it to me? And I think the best way I can describe it is we're trying to use the test when it's most effective. If somebody has mild illness, even though it's frustrating, and they can stay at home, they may have to deal with not knowing the answer yes or no, do I have the virus? But if they can effectively stay at home, we can then use those tests for patients in the hospital when we very clearly have to decide, does patient A go to nursing unit A or does patient A go to nursing unit B? And it makes a big difference when we're trying to keep hospitalized patients safe. And so what I can tell you is at my hospital and at other hospitals in my county and in my public health department, we are working tirelessly to get more tests because the goal is everybody can be tested so we can quickly know the way we do with influenza.
I do want to jump in a little bit. This is unfortunately for the public when doctors don't always have the same answers to questions. I want to add on to what Dr. Gerber said about the immunity testing. So first and foremost, it is not available widely. So for folks that are looking to rely upon that to know how many people have had this disease, as he pointed out, it is an indicator of past infection. We don't have enough of the test in any way to determine what our community prevalence is or proportion of our community has had it. On the other hand, as distinct from influenza, which we know is a rapidly changing virus, and that's why we have to get a different vaccine year over year. Coronaviruses in general are known to be very stable and not mutate in the same way flu viruses do. So while we do not know the length of time that someone who may have recovered from this disease will have immunity, we don't know if it's months or a year or many years. Coronaviruses do, in fact, as the common cold, we know that people can get reinfected. And even with this virus, there have been some cases of reinfection. For the vast majority in the short term, having the type of antibody shown in this test is likely to mean over a period of months that the person is safe from reinfection at that point. Dr. Birx at the national level has been tossed that very difficult question as well and answered with this sort of uncertainty, but the predominant understanding of what having that immunity in the short term looks like is that it may in fact give us a cadre of people who can be more safely back in the workforce. So it is correct to say that there's a lot still to be learned. There's a major supply that needs to come to make it of value to our community, but it is something for us to be looking at.
Thank you both. We have another question for Dr. Borenstein. We are getting a lot of questions about when the shelter-in-place order might end, including how that might impact schools starting in the fall. Can you share any insight on the shelter-in-place order?
So at the local level, we are at, under both a county order and a state order at this time. The County of San Luis Obispo, given the types of statistics that I shared with you, is ready to move forward a little bit more aggressively than the state at large. Understandably, the state is looking at all of its jurisdictions, and there are many places that are still seeing upticks of cases or having really challenging situations, again, particularly in congregate settings. So while we're ready to move forward, we still need to wait for the governor to give us that allowance. While we are waiting, we are working very aggressively with all of the sectors of business, as well as our faith community, as well as our school community, as well as government, city and county, to put plans into place for what our reopening would look like as we move forward. You asked specifically about schools, and most our school districts, I think it's pretty well understood, everyone across the state is probably not going back to school this school year. There are a number of questions about what summer might look like. Is there the opportunity for some summer school? Is there extended year for children with special needs? Those questions will be answered over the coming weeks, and we hope to be ready for that, even for summer. With respect to fall, we are working with our school systems to look at ways that they can revise the ways of the method and manner and timing of instruction to continue to have in place some measure of protection. And it's not so much for the school children, though there certainly are cases of severe disease in youngsters. But the main reason to be very cautious with transmission in the school setting is because so many children go home to situations where they either have elderly parents or grandparents who are at high risk or medically vulnerable underlying conditions. And so those are all the types of things that we're going to be looking at as we get back into some measure of normalcy for student instruction.
Thank you, Dr. Borenstein. So we have time for one more question. Thank you all for those who have used the Q&A function. Our last question is going to be for Senator Monning. When considering reopening the economy, what guidelines need to be followed? And do you have any insight on any sort of timeline?
Well, thank you for that question. I know there's a number of questions we haven't been able to get to. We will encourage people to share those directly with our offices. You can connect with my offices at sd17.senate.ca.gov. In terms, there's no specific timetable in place, either statewide or in local jurisdictions, but the governor has set forth 6 criteria or pillars that will be looked at in reviewing timetables for reopening, for moving back to some business operations. I think as Dr. Borenstein and Dr. Grover both indicated, there's a lot of complexities here. It won't be light switch back on, everything's back to normal. We, I think, can expect to see gradual reopenings of certain essential businesses, still encouraging social distancing as we move forward. The governor is providing daily updates at noon that you can live stream, and I think this is the best real-time information as to how the state is moving forward as a state. And we do work closely with our local jurisdictions, recognizing the very different circumstances that may exist in San Luis Obispo County as compared to San Francisco or San Diego counties. I think it's important for people to understand we have not reached peaks, or we are reaching what are assumed to be peaks this week, next week around the state. And what that means when you use the terminology a peak, it means you're going to have as many deaths following as you had leading up to that peak. And I think the reminder of caution and precaution is to look back in our history to the Spanish flu virus of 1918. The second wave of that killed more people than the first wave. And to put it into perspective, it happened around the time of World War I. 16 million combatants died in World War I. Over 50 million died globally from the Spanish flu, and the majority of those in the second wave. So as the doctors have indicated, part of the criteria for moving back, testing is part of that. Also, one of the criterion is to be able to pull back if we recognize an uptick in reported positive cases, illnesses, hospitalizations, and deaths. So we're finding our way through this. There is no blueprint. I just want to, again, applaud the public health doctors, the scientists, and the pulling together of private sector and public sector to put the best information forward. I would echo what Dr. Grover said, to look at reliable websites and public information in terms of informing yourselves, your families. We want to get this right. We want to minimize the adverse health impacts so that we can adapt and return to communities that I think will be much more vigilant in respecting our frontline health workers, our first responders, and all of the service workers who again have stepped up to help us. I think we are probably coming up on the end of our time allocated for this community get together. It's the first time we've initiated this from our office in the 2 counties. And again, I just want to thank all the participants. I would direct people to the website that I mentioned. I'd also acknowledge today is Earth Day. And as Earth Day, Let's also see what this coronavirus might teach us about how we use our resources, how we organize our medical and public health resources, and how we move forward as supportive communities to protect one another, to protect our public health, and to protect our precious environment that sustains our public health. And I'll turn back to our resource staff people, see if Annie Frew has any concluding recommendations as we end this. I also just want to again thank Dr. Bornstein, Dr. Grover for joining us and for your ongoing work. Please thank your colleagues on our behalf for the work they're all doing. Thank you.